Hello nursing students. This is a video lecture for terminology. I am aware that you do have a terminology test coming up soon. So let's get started. You can view this PowerPoint/video over and over if you like. I have reviewed your terminology quiz and the PowerPoint. There is one correction in there and I will write it out in the announcements. Well, let's get going. So here's the beginning of your terminologies. So as we know that BRP stands for bathroom privileges. So when the doctor writes an order, BRP, the patient can get up and go to the bathroom, not wander around in the hospital, but up to the bathroom only. Hemiplegia, you may get patients back who've had a stroke or had some type of medical condition that's going on. But hemiplegia is paralysis of one side of the body. Now, when you see this word lymphoma, think about growth of fat cells under the skin. You might be asked that by your neighbors or your friends. Oh my gosh, I have this lump under my hand. What is this? Or, you know, we don't diagnose, but in your mind, you're probably thinking, oh, this might be growth of fat cells. Dehiscence. Now, this is important because we will start in 214. Med Search 214, and we will get patients post-operatively, and they will come back with wounds. Not wounds, but incisions from their surgical site. Now, when the surgical site has complications in which a wound ruptures along a surgical line, meaning when a doctor sutured or stapled that incision that he did for surgery, and the staples or sutures, or maybe the patient's staples and steri-strips have been removed and the wound begins to open, dehiscence. Make sure we notify the doctor right away. Now, WA also is abbreviation for while awake. Let's look at this. Now, sometimes we want to start an IV, and you'll get that later on, and I believe throughout the program, but not in this class or 214. But when you start an IV, but prior to starting, you're assessing. Remember, we're using our eyes for inspection, and we're looking, and we see some inflammation of a vein. It's red. It's probably maybe hot to touch and tender to touch. So that means the patient has signs and symptoms of phlebitis. So do we want to start an IV in that area? Heavens, no. Now, prior to surgery or different procedures or even lab work, the physician may say, nothing by mouth. You see that abbreviation right here on your orders, NPO, nothing by mouth. Not ice, not water, just a little sip. It absolutely means nothing by mouth. If there's any exceptions, the doctor will put NPO except for sips of water as such. But once it says NPO, it is NPO. Now, lithotripsy. That's a treatment typically using ultrasound shock waves. Now, why are those ultrasound shock waves? Ta-da-da-da-da! They may be because you might have a kidney stone or other type of callus, and then it's broken into small particles that can pass out by the body, which is lithostones. So lithotripsy is a treatment where the doctors go in and you have to go in there and see, and it helps break up those stones. Now, AC before meals. Now, you're going to see this frequently, especially for patients who need to check their blood sugars or any other thing that the doctor wants done before meals. AC, ad lib, as desired. Terminology continues. What about this? Oh my gosh, this light is really bothering this patient's eyes. The patient says, can you please turn the light down? I have such a horrible headache. Sorry. So, light photosensitivity, a condition where bright light hurts your eyes. Okay, so don't forget, photophobic. I know I get a lot of patients who are having migraines who are photophobic. Hemolysis. That's when the blood cells are breaking down. Hemolysis. Sometimes we get certain calls from the hospital as a nurse when we draw blood, and they say the lab specimen has hemolyzed. Patient needs a redraw. So now you know those blood cells is broken down, so it needs to be redrawn. And now we have leukocytes. Leukocytes are basically your white blood cells. Necrosis. Now sometimes we look at certain wounds and we see that they're black. We know that there's no circulation. You know, when you try to check for capillary refill, there's no circulation at all. The color of the skin is black. There's actually no viable tissue there, so it is considered necrotic. So death of body tissue when too little blood flows is happening to the tissues. Okay, so death of the tissue. Ambulate. Now we all do this every day. We walk or we move about. So when we say, tell the patient we would like for you to ambulate, or you might see in the orders, ambulate patient 3 times a day. Walk the patient 3 times a day. Alrighty, hematomegaly, abnormal enlargement of the liver. Abnormal enlargement of the liver. Okay, I'm sorry for the cough, you guys. Production of abnormally small amount of urine. Okay, don't forget oliguria. Now here we go. I know they're all mixed up and matched up, but PC. So remember earlier we had AC. So now we have PC. So that is after meals. Don't forget after meals. Dysphagia. Now look at here. Now I always look at different things to help me remember. Dysphagia is difficulty or discomfort in swallowing. Difficulty swallowing. Now how I remember this, I look at the G, and I don't know, but you know your professor's a little, I'm not going to say anything since this is recorded, but anyway, we look at the G. So when you look at the G, for me, I think about a turkey, gurgle, gurgle, gurgle. So the G for me helps me tell the difference between dysphagia, and then there's going to be another word you're going to learn further along called dysphagia with a S. So dysphagia with a G is for swallowing, because you're going to think about that turkey, gurgle, gurgle, and he's swallowing, difficulty swallowing. Now BM is a bowel movement. Patient have a bowel movement. We all have those every day, hopefully every other day, a bowel movement. Hematuria, that's basically blood in the urine. Hematuria, blood in the urine. They look around in the toilet. You know, we use our eyes for inspection of everything. Everything. If you're in the bathroom with the patient and you happen to get off the toilet, you are observing the stools to see if they have any color, like if they're dark or black or blood, anything that's abnormal, anything that's out the ordinary. If you see pinkish urine in the toilet, or after you clean the patient on a towel, you know, we need to notify the doctor patient possibly has hematuria. That's after urinating. Empyema, collection of pus and cavity of the body, especially where? In the pleural space. If you guys forgot this, please look up the pleural space. We will talk about that throughout your nursing in this program. Stat means stat. Stat means immediate. Stat means as soon as possible. Doesn't mean tomorrow. Doesn't mean in 5 hours. It means stat now. Okay? I think I beat that enough. Bradycardia, abnormally low heart rate. Okay? Normally less than what? 60. Because you guys learned what normal range is. So under 60 is considered low. Under 100 is considered fast. Bradypnea, low respiratory rate. You see that? 10 or less of the respirations. Tachycardia, high heart rate. And I said earlier, what is it? So if it's under 60, it's low. Bradycardia is if over 100 is high. Okay? Same goes for your high respiratory rate. I'm not going to call out the normals. Please look in your book. What is normal respiratory rate? It's from this number to that number. I really want to tell you, but you have to look it up. And then if it's over the normal range, it's considered tachypnea. Okay, you might see this, and it'll help you with your documentation. C/O, patient complains of, blah, 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 blah. So you can say, in your writing, patient, PT, complain of, CO, and keep on going. Diastolic. We all should know what diastolic means by now. That is the number at the bottom, the blood pressure during that part of the heartbeat when the heart's ventricles are relaxing. Yes, I knew you knew it. Disoriented. You know how we ask about orientation. So disoriented, confused as to time and place. So we have to make sure when we introduce ourselves, we don't say, "Hi, Mr. Jones." We say, "Hi, I'm your student nurse today, and could you please tell me your name, your date of birth, who the president is, why you're here, do you know why you're here, what type of place this is," things like that to tell the patient's orientation to see if they are oriented or disoriented. HS, hours of sleep, basically bedtime. The doctor might write, patient needs, please have a meal at HS, bedtime. Hypertension, blood pressure remains abnormally high. Normally there's 3 checks to diagnose the patient with hypertension. Hypotension, abnormally low blood pressure. Incontinence, involuntary urination or defecation. So that means they don't have any control, and unfortunately they have accidents. No known allergies, NKA, no known allergies. And over here is NKDA, no known drug allergies. And what about out of bed? OOB, out of bed. Okay? Then please know these terminologies. PRN, as needed. ROM, range of motion. Remember I told you earlier, we was going to see that word again? Okay, remember dysphagia with a G, that's difficulty swallowing. Now dysphagia with the S, deficiency in generation of speech. Okay? So please know the difference. That's how I learned the difference, but you might have a different way, but that's just how I had learned the difference. CBC is complete blood count. Dyspnea, difficulty or labor in respirations. You might say my patient is having some dyspnea, and I'm like, oh really? So they may have some nasal flaring, or you might see they breathing labored. They see their chest, they having a hard time breathing. We definitely want to help those patients. Now, sometimes patients have difficulty or painful urination, dysuria. Okay, they're vomiting, emesis, Gait is how they walk, steady gait or an unsteady gait. We need to document that. Nocturia, excessive urination during the night. They're up all the time, up. And that is it. So I tried to do this in less than 15 minutes. I hope this helps. You will have a terminology quiz. I'm just going to take the PowerPoint backwards. You will have a terminology quiz. It will be based on this PowerPoint and nothing else. So please study this PowerPoint, and you can review these terms over and over again and listen to my beautiful voice and rewind, fast forward, and learn these terminology, all of them, because your upcoming quiz will consist of 20 questions. Okay, and it's not going to say something, it may be in a sentence form, it may just ask you for a definition, but you need to know them. Okay, well, thank you so much for listening. I'm Professor Roberts, and I will see everyone on Wednesday at 2 p.m. Take care.